And at the end of the day, that's what all physicians want. We want to be able to take good care of our patients, but we want to be paid a reasonable fee in a reasonable amount of time without a lot of headaches and paperwork. Hey, I'm Dr. Michael Havig. I'm the founder and CEO of HealthMe's Technology. And what we do really is we are a digital marketplace for healthcare that gives doctors the ability to retail their services to patients who are uninsured, underinsured, those in sharing ministries, and really anyone that's paying directly for their health care, which actually includes self-funded employers. I'm a physician, practice in my hometown, and a lot of my friends that I grew up with are small business owners, right? So they're contractors, they own restaurants, things like that. And a lot of them elect not to carry health insurance, or they have this super high deductibles. And what I learned from them is I was actually turning them away. They were calling to try and make appointments, and because they didn't have insurance or out of network, my staff just said no, and they made it clear they were willing to pay cash. And I thought this was kind of crazy, just because I think every doctor would say, yeah, I'm happy to take cash, and their administrative teams would say the same thing. But we just teach our staff to really do third-party billing and collecting. And when someone asks what it costs to see the doctor, they don't know, right? Because we're asking them to predict the future. Is the doctor going to spend 5 minutes or 50 minutes? Is it going to be an x-ray? Is it going to be a lab test? And so it's impossible for them to put a price on a service. And because of that, actually most offices just turn these folks away. And what I realized is actually we do very similar things for very similar complaints. And so it's actually not that difficult to bundle healthcare services. And then you can put a price on them. And then you can give patients a price, and everybody wants to know their price. No one wants surprise bills. So what I found is we solved that problem for my office, and then my colleagues started wanting it at the surgery center, at physical therapy, referral, clinics, and it turned into a business from there, right? And we continue to grow primarily in the musculoskeletal space, but we're moving into other specialties now as well. Well, I think we can all agree, like, our healthcare system is broken in a number of ways. Actually, I think we provide really good care in our country, but it's just too expensive, right? And it's unaffordable to patients, to employers, really to anybody paying the bill. And the way we pay for it is broken. I mean, CPT, ICD codes, HCPCS codes, I mean, nobody understands it. Doctors don't understand it, patients don't understand it. Most insurance people don't understand it, but somehow it all goes into this black box and something comes out and it's a bill and nobody understands it. And my mission is really just to improve that, like for patients and providers. Like, why can't I just say it costs X dollars to see me and the patient knows and pays and we're done? And it's just simple. It saves me time and energy and money. I can concentrate on just taking care of my patient. And at the end of the day, that's what all physicians want. We want to be able to take good care of our patients, but we want to be paid a reasonable fee in a reasonable amount of time without a lot of headaches and paperwork. And so I think we can lower costs by getting rid of some of this kind of fat in the system, if you will, this whole complex billing and collection process that we're all forced to go through. I'm just really passionate about trying to solve these problems that we see with access to care for patients. Nobody knows healthcare costs. It's very confusing for all parties. Everyone thinks doctors know what's going on. We don't. The patients don't know what's going on with billing. Even our expert billers are often confused by the current system. And so I'm really excited to get out of bed every morning to try and kind of solve these problems and really simplify healthcare for patients and providers and everyone in the system. We got a lot of exciting developments coming into 2023. I built the platform really to solve for local direct payers. These are my, friends and neighbors who own small businesses who can't afford health care or that elect not to carry health care, as I mentioned. But really what we found is if we can grow this network of transparently priced bundled care, that's appealing to self-insured employers and the whole ecosystem that navigates patients for them. So the market we're really moving into here is kind of the self-insured employer market, and be able to provide them a network where everybody knows the costs in advance. The patients can navigate it in a very consumer-centric way as opposed to the kind of mayhem that they encounter now. And so we're building those relationships here at the health meeting and also in other ways. So we're really excited to kind of move into that arena and be able to serve more patients. So we're really excited, the UCSF Digital Health Awards. I mean, that event last night, it seemed like the Oscars of healthcare, right? It was pretty crazy. But, we applied, and I thought, we had a strong application. I think our company is very strong. But then again, over 1,000 people applied for these awards, and I mean, you never think you're going to win, I guess, is what I'm trying to say. And to actually be a finalist and then actually win an award, I think it just validates what we're doing, right? It's a lot of time and energy, not just me, but my whole team. It's really just a win for all of us, and it just after a number of years of trying to figure out a better solution for the problems we discussed, I mean, it's just validation by the industry that I think we're going in the right direction, and we're really solving a problem for a lot of people, and hopefully, we can reach our goal of really simplifying the healthcare and the payment process for everyone, the patients, the physicians, the payers. So it's really exciting, and we're really honored to get the award. It's amazing.